Public health officials are moving quickly to contain and study the hantavirus outbreak that started on that cruise ship. Today, through NBC, we learned that worldwide the number of confirmed cases has gone up to 11. But we talked to a doctor today that makes it clear that every confirmed case is still linked back to this singular cruise ship and the outbreak on the cruise ship. Some of the passengers being monitored here at Emory here in Atlanta. Experts say this is not a new virus and it is not a pandemic situation. Monica Robbins has just the facts over fear.
This virus is not new, and no, this is not another pandemic.
There's a lot of medical experience with this virus, even though this situation is different. And this situation is different because it is a more of a global outbreak, because it's the first time this has happened on a cruise ship. And that changes, right, the awareness of the entire globe to an infection.
This is not another COVID. It will not be any pandemic. But still we can learn from this and continue to build our response.
This virus is difficult to spread.
And this hantavirus, the Andes virus, is the only strain that is person to person. But again, very difficult to spread. It is close contact with bodily secretions or respiration, sharing things intimately, toothbrush, etc.
Exposure on a cruise ship is unique and explains close contact.
That all of the sequences are almost identical, that there are very few differences in two cases, one on each, and that means it's strongly on support of a single source of of infection. The second point could be that there is prima facie, there is nothing different about this strain compared with others.
The U.S. is no longer part of the World Health Organization.
When it comes to this hantavirus Andes outbreak, there is no danger to the general public. When it comes to the dismantling of the CDC with firing thousands of staff, we still have a part-time director at CDC. Most of the unit directors are acting or part-time or vacant. We are much less safe. We can't have a safe USA with a weak CDC.
There's a reason the Americans are in Nebraska and at Emory University.
We here in the National Quarantine Unit and the Biocontainment Unit are absolutely prepared to monitor these individuals for that entire quarantine period, should our federal partners and the individuals being monitored choose to do so.
We can say very securely that our system worked, our preparedness worked, and most importantly, my teammates performed very, very well.
More cases are expected before this is over.
The incubation for hantavirus or Andes virus ranges 6 to 8 weeks. So we expect more cases to come actually, but I hope they will be as small as possible.
I'm Monica Robbins reporting.
Couple of things to really point out there. They were just talking about the incubation period being up to 42 days. So some of this just takes some time. But as you remember, 2 passengers from that cruise ship arrived in Atlanta yesterday. We saw them in their full hazmat suits as they were taken to Emory. And just moments ago, we got official word from the Regional Emerging Special Pathogen Treatment Center at Emory. This is the group overseeing, monitoring these 2 potential hantavirus cases, that the Atlanta person tested negative for the Andes variant of hantavirus. So that one person that was deemed symptomatic had some symptoms, so they were wondering if that person might test positive. We've now confirmed that is a negative test. The second person who came did not have any symptoms because they had been in close proximity for so long on the ship, though they wanted to keep a close eye on the second person here in Atlanta. So now we can confirm that there's been a negative test, but our understanding is they'll continue to be monitored for quite some time because of that 6 to 8 week incubation period where symptoms can still pop up. So that is the latest on the hantavirus outbreak as it relates to the 2 people being monitored here in Atlanta.